Welcome to Living Legacies with LaVeta, a premier financial podcast for all generations. I'm your host, LaVeta Hayes, and I'm so excited for you today because we have Marlencia Dotson, an exceptional consultant specializing in Medicare and life insurance. So let me ask this. I know they call you Marley, right?
Yes.
Marley is your nickname.
Yes.
So tell us a little bit about Marley. I know you have your company. Tell us a little bit about your company.
So my company is Just Ask Marley, Medicare and Life Insurance, LLC. And I started my business in March. It was a birthday gift to myself. I decided that I wanted to go independent with my Medicare so that I could have flexibility. I have 3 kids, and I didn't want to be tied down to missing basketball games or practice and things like that. I implemented the life insurance part of it, which is not all the way rolling, but I did that because life insurance is so important to me. When I started doing insurance, I started at State Farm, and at State Farm, Tony Pearson State Farm in Ormond is where I started my life insurance. And he taught me so well to the point where I just know it's something that you need to have.
And I tell you, the reason why I wanted you to be on today, because in January, I am qualified. So it is so confusing. It's so confusing. A, B, C, D. I just don't know. So that's why I wanted everyone to be able to listen in and hear what is A, what is B. Give us some examples of how you would sit down with someone like me. I was 3 months out, okay, and January will be the day. So tell us a little bit about how you would sit down with someone and go through the process of Medicare.
So there are a lot of Medicare guidelines you have to follow in order to have a Medicare appointment. Number one, the person has to want the information. You do not solicit Medicare. So like you wanted me to come here and talk to you about it, you initiated it. That's the most important part. Secondly, there would be a scope of appointment. You have to set up an appointment. There are guidelines for how many days out the appointment has to be before you talk. And so once you get past all the regulations that Medicare has, you sit in front of the client and you go over their options. So Medicare Part A is hospital. Part B is medical. And so with that being said, Medicare Part A and B, Medicare takes care of 80% of that. And then the beneficiary is responsible for 20% if they stay on original Medicare. There are also supplements that take care of the 20% Medicare does not cover, that you actually pay a premium for on top of the Part B premium. And then there are Medicare Part C plans that are at no cost to you, the majority of them. And some of them do have premiums. It just depends on your needs. So what we do is a needs assessment to see what works for you. Everybody's situation is different. Some people have Medicare and Medicaid where they qualify for way more benefits than someone who just has Medicare Parts A and B. But regardless, whatever your financial situation is, there is some type of solution. And that's where I come in to help you decide what is best for you.
Okay, wow, that's a lot of information and very good. I like the way that you simplified the Medicare and also talked a little bit about the Medicaid. Now, in my situation where I'm a federal government worker, okay, I have my health insurance also. So I want to talk a little bit about what do I do? How do I sit down and actually talk about what plan should I use? Should I go with a C, A, B, C, or something different?
So, being that you have an employer plan, the first thing we're going to tell you is to check with your employer plan to make sure they're not paying for your plan itself. You know, some employer plans are sponsored by the employer, especially with it being the federal government. It's really touchy. We don't like to step on their toes. So we let you talk to them first. And if it's a financial thing where some people are like, I just can't afford to pay for my government plan because it's not government sponsored, and you need something that's less cost efficient, then that's when you want to look at maybe a Medicare Advantage or a supplement that has a lower monthly cost.
Okay. Now, there are so many different carriers?
Correct.
Okay.
And they're private insurance companies.
And private insurance
They're private.
companies.
Mm-hmm.
Okay, they are private.
Yes. Medicare contracts these companies to give those benefits out.
Okay. And when a client is sitting down with you, with them being so many different plans that's there, will you be able to help them say if they need to cut costs? Also, can you talk a little bit between Medicare and also Medicaid?
Mm-hmm.
Okay.
So really with the plans, I don't represent every Medicare Advantage plan in the area. I represent WellCare, I represent Humana, I represent Devoted Health. So there are there's a plethora of private companies that offer Medicare Part C and supplements. So the agent per se, like myself, I can only discuss the ones that I'm contracted with by law. So I can't tell you anything about Aetna. I can't tell you anything about Florida Blue. Now, I have been employed with those companies. I've been employed with WellCare. I've been employed with Florida Blue. So I've been a broker. So I've done almost every plan you could think of at some point. So the real thing is all of the plans have different benefits. They give you different things. It's all based on the needs assessment. What do you need? Okay. What is your financial situation? What are you looking for from the actual plan? That's the Medicare side. Now, Medicaid is state funded. That has nothing to do with Medicare, Parts A and B. They're separate entities. But if you have Medicaid and Medicare, you go on a dual plan if it's a qualified level of Medicaid. Medicaid has full benefits, and they also have all the way down to Q1, which are people who really don't qualify for Medicaid, but it helps pay their Part B premium for them. So like I said, it just depends on exactly what your financial situation is. There are some people who prefer supplements that take care of the entire 20% that Medicare doesn't cover while they're paying a higher premium each month. Some of them are lower, but they have to reach certain deductibles and things like that. So most of my clients, the geographic area that I deal with, most of those people are looking for Medicare Advantage plans. And that's because they want to contain costs and know what they have to pay. Summary of benefits is provided to the client when we're in the appointment. So they are able to see exactly what the plan copays are. The tiers of prescription drugs, which we haven't discussed yet, but there are prescription drug plans you can go on along with the original Medicare rather than having a Part C plan. It can be a standalone prescription drug plan. But the Part C has Part A, B, and D, which makes it the Part C. It covers all parts of that.
Okay.
And you can't have that and something else. You have to have it or have something else.
Okay, you see why we have her here today, right? Because it's a lot of information. One of the things you mentioned about prescription plans, and I understand there's a dental plan too that's outside of, do you pay extra for that?
If you want it, it's a supplemental dental plan. So say, for example, the plan that you select only has preventative dental, that's like cleanings and x-rays and things like that, and you want something more comprehensive, you'd pay a monthly premium on top of if you have a plan premium for the Medicare plan, or if there's a $0 copayment for the $0 monthly premium, but you want a dental plan, you still have to pay that out of pocket. That's not something that Medicaid will cover or anyone else. That's something that you would have to pay yourself.
Okay. So if I know like now that next year I'm going to need dental work. Would I stay with my regular plan, or would that be something that I would look into a separate plan?
Well, if you're going to keep the plan you're on now, and so you said you have an employer plan, you can always go out and get a standalone dental plan that you would actually pay for yourself. And you can use that way. You can also have a standalone dental plan with a Medicare plan, but it won't be covered under Medicare.
So what do you believe your life mission statement is?
You know, everybody that I encounter, I want to use my skills to positively impact my community and leave a lasting impression on everyone I encounter. Your first impression is your best impression.
That's true.
And so really by doing that, my business kind of works for itself. When I leave that impression on someone, they tell somebody else, and they tell somebody else, and then so it's work. I don't have to work as hard because people come to me because they know I'm an expert in that category. So it just works. Being ethical, having morals, because sometimes the plan isn't, gonna actually be for that person, and I'm the person to tell them that. Some people aren't as honest. They just want to do it so bad that they're like, yeah, you should take this, but I'm not that type of person. I'm not that type of agent.
Yes. And when you talked about referrals, that is so important, because that's how I got to you. I asked someone the question and they were like, oh yes, I know Marley. And I'm like, do I know this person? And they were like, yes, you do. You already know her. I'm like, okay. And when they, like you said, the referrals are so important. So anyone, when we're talking about Medicare, Marley is your person. Now, let me find out what are some of the pivotal moments that changed the way that you approach your business and finance and everything.
Well, really, are you meaning my finances, or you mean when I'm talking in a meeting?
Talking in the meeting.
Really, that's part of the needs assessment, seeing how much someone can afford per month for insurance, whether it be life insurance or a Medicare Advantage plan or a supplement, how it goes into their budget. What can they actually pay per month? Because if they don't pay it, they'll get kicked off the plan and then they won't be covered at all. So the best thing to do is to make sure that whatever plan they get on, they're going to be able to afford it. Now, as far as life insurance goes, it depends on how much they're trying to cover. They might have a home, and they want to make sure that their loved ones aren't left with the bill when they leave here. So that person might need a $400,000 face value life insurance policy, whereas someone who doesn't have a home may be okay with just having $20,000 in life insurance because they don't have anyone to leave it to. They have no kids. They have nothing but a burial to worry about or something. So everybody's financial situation is, different. And so the real job of myself and any agent in financial services is to make sure that you know what your client needs, listening to what they need.
What along the way, have you had mentors, especially when we talk about the Medicare? Who are some of your mentors?
I would say, as far as Medicare goes, I started at T-Tech, and it was a call center. So really, no one taught me anything there. It was training, and we kind of got thrown out there. And I left there, and I went to a brokerage where I did multiple carriers. That's where I got most of my experience. And that's when I realized that some people didn't work ethically with the clients. They were just like, yeah, sell. And it's really not about that. For me, it's about rapport and keeping my clients on my book of business, because people, if they find out that you talk them into something that they don't want or didn't need, they're going to cancel. And you can cancel the plan. So if they decide to do that, then that falls back on my reputation, and it falls back on my numbers with the company as well. And we have to answer to Medicare. If someone calls and files a complaint or anything like that, we have to answer to them. And after you get a certain amount of complaints, they take your license and you can't sell it anymore.
Wow.
So it's important to make sure that you are doing everything that they tell you to do verbatim, because it's, yeah.
So it sounds like you're really passionate about what you do.
I do. I am.
What gives you that drive? What gives you that passion?
Well, when I get done with an appointment and I actually am able to help someone, because I can't help every single person. And when I can't help them pick a plan, I give them a route to take after the appointment. Okay, well, I wasn't able to do this for you, but I do know that there are some resources here that you can use to figure out what it is that you're going to need. Some people don't have Part B. They might have Part A, no Part B. People are they have Medicaid and Medicare, and they're like, oh, but my doctor doesn't take this or my doctor doesn't take that, and they're drawn and they're pulling and pushing and pulling in two different directions, and those people deserve time. And some agents are really pushy and they don't give them the time. So I just try to do my best with being patient and being thorough and just following through. Now, after I sign clients up, I check on them every 30 days. I have to stay in contact with them. If there's something that's going on, it's important for me to take care of that so that they don't have to call the company and get the runaround. People get frustrated and they cancel.
Yes.
Yeah.
Now, what in doing that, what are some of your challenges that you're facing in the Medicare realm?
Marketing. Now, when I was with the actual company, they did all the marketing for me. I didn't have to do anything. When I worked at Florida Blue, you saw Florida Blue commercials. They made my appointments for me. You see WellCare commercials on the TV. They make they make those appointments for me. Whereas now it's all off of my face, my name. And I still have a name from being with those companies. My book of business is still there because I did everything the right way the first time. So those people reach out to me. And so the biggest thing is making sure that I continue to market every day. I have to make sure that I'm doing that. I have providers' offices that I go into. And it's really a competitive competitive field because there are a lot of agents. So what makes you different from the next person coming in my office offering me donuts or coming in my office telling me that you have a good plan? What's different about you? What's different about me is that I actually follow through. A lot of people just do it once or twice and then they're like, yeah, call me if you need me, and they never hear from them again. Whereas I just keep calling and I just keep coming because I'm trying to build a portfolio for myself and also make it to where my kids see where I have more time with them because of what I'm doing right now. Later on, I'm going to have way more time for them because of what I'm doing right now.
What are those fun things that you like to do with your children?
My son plays basketball, so he has practice today. So I enjoy watching him play basketball. He's 7. My daughters, they sing. Very well, but they're camera shy and they don't want to go in the studio and stuff, but I've been trying to get them to do that. And so we just fellowship. Yeah. It's important.
I love that.
It's important.
I love that.
So that they know that they're loved.
What advice, what type of advice would you give to young professionals that's coming into the industry?
I would definitely say make sure that you love what you're doing. Don't just be in it for the sale. Don't just be in it for the enrollment. Because at the end of the day, if you wouldn't do it for your parents, if you wouldn't do it for your grandparents, then don't just set people up for failure. You just want to make sure you're doing the right thing. If you decide to go in financial services, make sure that you're not doing it for the wrong reasons. Of course, you want to make sure that you're leaving a legacy for your family, but make sure that you're doing it the right way so that you're not tarnishing the legacy of your family.
That is very, very important. Thank you for that. Are there any, when we're talking about Medicare, are there any trends that we need to be aware of as we're that person that's turning 65? Any trends or that we need to look into?
Each year, the Part B premium can change. It can go up, it can go down. And that's all based on what Medicare decides, based on the income thresholds and things like that. Something that's completely out of our pay grade and what we do, but that can change every year. Every year it can change. So it was $164 and some change this year. Next year it'll be $174 and some change. So $9.80 per month difference for the Part B premium moving forward. Okay. Now, like I was saying, some people on Medicaid, they don't pay that Part B premium. Medicaid pays it for them. Okay. So they don't have to pay that because they're under a certain poverty line.
But that's for Medicaid.
They pay for Medicaid. Medicaid pays their Part B premium on Medicare for them.
Okay.
So it does help.
Okay.
By having both.
Okay.
Mm-hmm.
Wow. Any other trends that our listeners need to know about?
Yeah, I would say that some people aren't aware that they qualify for additional benefits. Those include dental, vision, hearing, over-the-counter allowance, transportation to and from the doctor, the gym memberships that come with the Part C plans. Some people qualify for bill payment. Some people qualify for healthy food cards to help with their nutrition. There are also plans to help those who are diabetics. There are diabetes plans, heart plans. There is something for everyone with Medicare Part C. And if you have a lot of health issues and you can afford it, you may want to look into a supplemental plan, because then you won't have copays after you reach a certain amount, depending on which supplement you go on. So there's something for everyone.
Okay.
So you don't need to be scared.
Okay. Now that I have you, Marley, I know that I'm good. So I know that I'm going to make sure that I make the right decision for myself. Right?
Exactly. I'm going to explain it to you, and we're going to go over it, and then you make that decision. What I do is tell you about it, you make the decision, and then I help you enroll.
Wow.
That's it.
Wow. Now that's what I'll need for sure. So we will be setting an appointment after this. That's for sure. Because it's confusing, and other people have come to me also asking questions, and I'm like, I don't know. But now I know Marley to be able to give that sound advice, which is very important for any of us to make sure that we get sound advice and somebody that is really looking at that age group. And when we're talking about 65, when shall we start looking at Medicare?
Well, actually, some people who aren't 65 qualify for Medicare. If you're under 65, it's usually you're disabled for 2 years or more, or you were born with a disability where you qualify for Medicare under your parents or a guardian. So some people under 65 do qualify for Medicare. It's my job, if they tell me that they think that they qualify for a disability, that I check to see if they're A and B eligible. Other than that, and those that are 65 and up, if they're not happy with their plans, they can switch during the annual open enrollment period. There's a Medicare, there's also an open enrollment period where you can either switch to another Medicare Advantage plan only, or you can go to original Medicare. That's all you can do from January 1st to March 31st is switch or go back to original Medicare, switch to another Medicare Advantage plan. There are some 5-star plans that you can go on to throughout the year. That means that Medicare rated the plan as a 5-star plan, and so that they get a special enrollment period for all of that.
And how can we get in touch with you? How can the listeners get in touch with you?
Yes. So just ask Marley, Medicare and Life, LLC. You can follow me on Facebook. And my email is justaskmarley386@gmail.com. And I'm also a notary public. So that page would be Your Pretty Notary Lady on Facebook. And the same email address, justaskmarley386@gmail.com.
Thank you so much for watching Living Legacies with LaVeta. You can watch us every Monday on all podcast channels.